Thank you for tuning in to the Wellbe podcast. This is your host, Adrienne Nolan-Smith. I'm a board-certified holistic patient advocate, and my goal with this podcast and all my other work with Wellbe, which you can check out at getwellbe.com, is to empower you in your health, helping you avoid chronic symptoms and diseases, and helping you heal them as naturally and holistically as possible when they do come up. This week, I bring you the January through March 2021 Wellbe Wrap-Up. If you've never heard one of our wrap-up episodes before, we cover 3 months worth of health and wellness news and research that we think is really important for you to know. From the results of big new studies to actions by the EPA, FDA, and other government bodies that affect the health of all of us. Then we break these stories down for you and put our own little twist on them. Before we jump in, if you like the Wellbe podcast and haven't yet left a review or subscribed, please do so now. You don't even have to stop listening to this episode. Just scroll all the way down on the Wellbe podcast page in your app and click Write a Review. Then give us hopefully 5 stars and a few words, and then press Submit in the top right-hand corner, and boom, you're done. Also, if you missed it, I shared a big, exciting announcement, which is that Kelly Gores, the filmmaker behind the Heal documentary, and I have teamed up to bring you a Roadmap to Healing, a new online program and experience that will take you through the exact components of a successful healing journey, step by step. Registration will only open once in 2021 in a few short weeks, so head to getwellbe.com to learn more about it and join the waitlist to be notified when the doors open. All right, now, as you can imagine, COVID news and research is woven throughout our latest wrap-up, but there were certainly several other pieces of health and wellness news and research that came out that had nothing to do with COVID that we had to share with you related to endometriosis risk, nutrition, blood pressure meds, schizophrenia risk, heavy metals and other toxins found in baby food and fetuses, some pretty shocking corruption cases, and new interesting research on sleep, dementia, exercise, and the COVID vaccines. First up, a corruption roundup. The USDA has released its newest dietary guidelines, which omit recommendations from an independent scientific advisory board, and leaked emails show that Monsanto executives and U.S. government officials pressured the Mexican government not to pass a proposed glyphosate ban. Meanwhile, a new report outlines the financial relationships between industry and neurologists conducting research. Not great. So let's talk about the dietary guidelines first. To put together the new dietary guidelines for Americans, which won't be revised again until 2025, the USDA enlisted the help of an independent committee, which provided them with a scientific report outlining their recommendations. While the USDA heeded some of these recommendations, they notably rejected 2. First, that they reduce added sugar intake from less than 10% to less than 6%. And second, that the recommended maximum number of alcohol drinks per day be reduced from 2 to 1. While the USDA statement explained that it rejected these recommendations because, quote, there wasn't enough supporting evidence, unquote, the department has long been criticized for bending to industry influence. Over in another agency, the Office of the U.S. Trade Representative, industry is also shaping policy. Leaked internal emails show that U.S. officials have been working with executives at Bayer, the parent company of Monsanto, which owns Roundup, to pressure Mexico to abandon its proposed ban on the pesticide glyphosate, or Roundup. And all of this was happening while Monsanto was paying out $11 billion in a settlement with Americans who claimed they developed cancer because of the pesticide. Thankfully, the pressure doesn't seem to be working, as the Mexican government has been going ahead with its plan to phase out use of the pesticide by 2024. Unfortunately, the reach of corruption extends beyond the walls of government agencies and big industry. In a new report published in the academic journal Neurology, researchers looked at how money from industry was influencing the papers published by physicians in major neurology journals. They found that 10% of authors had received payments from various industry players, some of them netting upwards of $1 million. They also found that these payments weren't always disclosed or were disclosed incompletely. So why does this matter? Why is this our first story? It would be nice if we could trust the authorities out there to have our best interests at heart. And while many government officials and clinical researchers genuinely do prioritize public health above all, the sad truth is that much of science and health policy is actually dictated by corrupt industry influences. What this means for us is that we should always do our own research, We should seek out truly trusted and transparent sources of information, and several different kinds, and always remember that you are the one who gets to make the choices about how to treat, feed, and protect your body and health. Unfortunately, those big government agencies and officials that we think are looking out for us, aren't always. So it's so important that you are looking out for you and your family above all. All right, our second story is that research shows that being obese can not only make cases of COVID more severe, but also decrease the efficacy of vaccines and make it more likely that a person spreads the virus. Plus, a recently released report asserts that hundreds of thousands of COVID-19 deaths could have been avoided if fewer people were obese, while at the same time, a global study shows that we're gaining weight during the pandemic. You might consider this a perfect storm. A new study looked at data from 909,000 COVID-related hospitalizations in the U.S. and found that the majority of them were caused by one of four cardiometabolic conditions: obesity, hypertension, diabetes, and heart failure. Obesity held sole responsibility for the most cases at 30%, but it's worth noting that the three other conditions listed are often caused by or associated with being overweight or obese as well. Obesity not only heightens the obese person's risk from COVID, but may also increase the risk of the people around them, according to another study. In this study, researchers examined the respiratory particles of both obese and non-obese subjects and found that obese people exhaled more respiratory droplets. Because the virus is airborne, this has a big impact on transmission risk. More droplets being exhaled by an infected person means it's more likely for a person nearby to contract the virus from them. Unfortunately, even a vaccine may not solve both of the problems I just spoke about because it seems that being obese may make vaccines less effective. Yep, in a recent study, researchers looked at the immune response of 248 healthcare workers who hadn't been vaccinated, taking into account age, sex, and BMI. Their results showed that all of these factors had an impact on the immune response of an individual, but that being older or obese had the biggest impact. The reduced immune response of obese people could even make it likely that this cohort would need to get an additional dose of the vaccine in order to get comparable protection. Given everything I just mentioned, it's perhaps not surprising that an analysis from the World Obesity Federation found that of the 2.5 million people who have died from COVID-19, almost 90% were in countries where more than half of the population is overweight. In countries with a low obesity rate, the likelihood of death from the virus is less than 10% of the likelihood in countries with a high obesity rate. Based on these numbers, they estimate that hundreds of thousands of deaths could have been prevented if people were not obese. All of that makes it particularly sobering to learn that the pandemic has caused people worldwide to turn to junk food and gain weight, according to a new global survey. The survey gathered information from 8,000 adults across the globe, spanning 50 different countries and every state in the U.S. The researchers found that across the board, people had become more sedentary, either stopping exercise altogether or exercising less intensely, and had increased their consumption of sugary and processed foods. These changes in behavior have had an impact, with 27% of people surveyed reporting weight gain in the past year. And the effect has been the strongest for those classified as obese, with 33% of this group gaining weight as compared to 24.7% of average weight people. So why does this matter? This matters a lot. We can't control whether or not a historic virus sweeps the globe and shuts down the world for more than a year. In fact, we can't really control viruses in general, but we can control every single thing that goes into our body and how our body will react if we come into contact with that virus. And everything we've learned tells us that getting rid of any chronic condition is the best way to support your immune system and fight off disease effectively, especially any lifestyle-related chronic condition. All of this research is a reminder that obesity isn't just a weight classification. It's a chronic condition with a huge list of negative health effects. Meanwhile, a healthy weight isn't about fitting into a certain size or looking good. It's about keeping your body functioning properly and protecting yourself from disease with a strong immune system. All right, story number 3 is all about nutrition. There's been a slew of recent research on which types of food hurt your health and which improve it. Both fried foods and foods with a high glycemic index, meaning foods that raise your blood sugar quickly, are tied to cardiovascular issues and death. And then separately, a healthy Mediterranean diet low in red meat and alcohol was linked with lower risk of colorectal cancer, as well as a healthier body weight and lower risk of heart issues. And eating a certain amount of fruits and vegetables, I'll tell you how much in a second, each day lowers your risk of mortality, aka death. So let's talk about the fried food. To understand the impact of fried food on health, researchers conducted a meta-analysis of 19 studies that included more than 1.2 million adults from around the world. So this is a huge amount of people. They looked at the subjects' consumption of fried food, things like French fries, fried fish, and other fried snacks, and compared eating habits to cardiovascular health. They found that there was a significantly increased risk of heart issues among those who ate the most fried food compared to those who ate the least. People who ate a lot of fried food had a 22% increased risk of coronary heart disease, a 37% increased risk of stroke, a 2% increased risk of death from cardiovascular disease, and a 3% increased risk of death from any cause at all. While this first study looked at how fatty foods impact cardiovascular risk, another looked at the impact of sugar. Specifically, researchers wanted to understand how heart health is impacted by foods with a high glycemic index, meaning they raise your blood sugar quickly. Think things like refined sugar, sweet snacks, white bread. The study included almost 138,000 participants around the world and compared their eating habits with their health outcomes. They found that compared to those with a low glycemic index diet, those who ate foods with the highest glycemic index had an increased risk of a major cardiovascular event and of dying from cardiovascular causes. All right, so moving on from what not to eat, a number of new studies shed light on the types of diet that can improve your health and prevent disease. In one study, researchers set out to see the effect of following a Mediterranean or a vegan diet on body weight and risk of heart conditions, so sort of comparing the two. They randomly assigned 62 overweight adults, so it's not a huge study, to follow either a Mediterranean or vegan diet for 16 weeks and took various measurements before and after. Their results showed that following a vegan diet improved body weight and insulin sensitivity and slightly decreased blood pressure, while the Mediterranean diet decreased blood pressure the most. So it seems like if high blood pressure is your primary issue, you might switch to a Mediterranean diet. But if you're interested in losing weight, improving insulin sensitivity, and also decreasing blood pressure, a vegan diet might be better for you. Next up, a review of several studies analyzed how diet affects the risk of colorectal cancer and found a strong link between the two. Specifically, they found that eating a semi-vegetarian diet that is low in red meat and alcohol is associated with a significantly lower risk. They also found that certain types of food were particularly helpful in reducing risk, including fiber, yogurt, whole grains, fruit, and vegetables, all of which are foods that support your gut health, so it makes perfect sense that they'd protect you against colorectal cancer. So fruits and vegetables are good for you. Groundbreaking, of course, you know that. But how many servings do you need to eat to get the benefits? Two studies that included more than 100,000 participants total found that eating 5 servings per day, 2 of fruit and 3 of vegetables, lowered mortality risk the most. Eating less than this meant a less reduced risk, so you definitely want to get your 5 servings, while eating more than 5 servings didn't have any additional benefits. So why does this matter for you? As I always say, your healthcare is the 100 choices you make a day, and food should be that primary source of medicine or healthcare. What you put into your body matters a lot for your health outcomes, both in the short and long term, and these studies just reinforce that. In my own life, I'm continuing to focus on eating a diet that's mostly plant-based and full of gut-supporting foods, while avoiding processed and inflammatory foods as much as possible. All right, story number 4 is all about antibiotics, both for COVID and UTIs. So a new study shows that a majority of women with UTIs were overprescribed antibiotics, while another found that doctors were unnecessarily prescribing antibiotics to COVID-19 patients during the early months of the pandemic. Meanwhile, several recent studies show that gut health is a factor in determining the severity of a person's COVID-19 symptoms. I've been saying this for a year, so hopefully you've listened to a previous episode and agree with me and are doing a lot to support your gut health. As you know, Wellbe has a free gut health guide, so you can go on getwellbe.com and grab that right now. So here are the details. A review of almost 700,000 cases of women with uncomplicated UTIs found that most of them were overprescribed antibiotics. Almost half of them, 47%, received prescriptions for inappropriate antibiotics, while 76% were put on antibiotics for an overly long amount of time. Another report shows that doctors were also overprescribing antibiotics during the early days of the pandemic. The study found that from February through July 2020, when there were still many unknowns about the novel coronavirus and treatment options were limited, doctors were frequently prescribing antibiotics to patients hospitalized with COVID-19, even if they hadn't found a bacterial infection. It looked at almost 5,900 hospital admissions and found that 52% of them resulted in at least one antibiotic being prescribed, and in 98% of these cases, patients received their first antibiotics within 48 hours of being admitted. Overuse of antibiotics has been a concerning issue for many years, but these two findings are rendered particularly worrisome given the fact that gut health appears to play such a significant role in determining the severity of COVID-19 symptoms. Two new studies looked at the microbiome composition of people with the virus and found that people with poor gut health were more likely to develop severe symptoms. They found that patients struck with particularly bad cases of the virus had depleted levels of certain types of bacteria that are involved in a healthy immune response, and concluded that the health of the gut microbiome plays an important role in determining how a person responds to the virus if they're infected. So why does this matter? In certain very specific cases, antibiotics can be truly miraculous and life-saving, but they also have immense side effects and should only be used where appropriate and necessary. Not only can overuse of antibiotics contribute to antibiotic resistance and potentially lead to superbugs that we can't fight off and may be the downfall of civilization, not to be dramatic, they also have a lasting negative effect on your gut health. And given how crucial gut health is to your immune system, and specifically your ability to fend off COVID-19, this is something we should all be concerned about. So I'm going to continue supporting my gut health through my diet and lifestyle choices and make sure that I only take antibiotics in a true emergency and with a culture to confirm a bacterial and not a viral infection before I start those antibiotics. All right, now story number 5 is all about GERD, which is a condition in the category of acid reflux and heartburn. So a large new study shows that the rate of esophageal cancer among people under 50 has been rapidly rising, potentially caused by more widespread GERD, while another study shows that making certain lifestyle adjustments can treat GERD symptoms more effectively than acid reflux medication. When we interviewed Dr. Jonathan Aviv about this topic a couple of years ago for getwellbe, we were blown away at the rates. And so this study dives deep into what he said. If you haven't listened to that interview, definitely search in your podcast app, getwellbe and Aviv, so AVIV, and it's fantastic. All right, so for this study, researchers looked at cases of esophageal cancer in the U.S. from 1975 to 2015 and found that the number of people under 50 diagnosed with the disease has been steadily increasing. They found an average annual percentage increase of around 3%, amounting to a 200% increase over that 40-year period. What's more, young onset esophageal cancer tended to present at more advanced stages and have lower survival rates. The researchers aren't sure what's exactly behind this trend, although our interview with Dr. Jonathan Aviv that I just mentioned goes really far into this, so if you want to know what's behind the trend, definitely listen to it. But they suspect that it could be caused by rising obesity rates in young people, which in turn can cause GERD, a risk factor for esophageal cancer. On the good news front, another study shows that adhering to certain diet and lifestyle guidelines can treat GERD symptoms better than acid-suppressing medication. The study included data from almost 43,000 women, tracking data such as diet, activity level, BMI, medications, and medical history, along with symptoms of GERD. They then identified 5 anti-reflux variables: having a normal BMI, so that's between 18.5 and 24.9, not smoking, getting at least 30 minutes of physical activity per day, limiting intake of coffee, tea, or soda to 2 cups daily. And that doesn't mean 2 of each, it means 2 total of either coffee, tea, or soda, and eating a healthy diet that's low in sugary foods, red meat, and processed foods. They found that when women adhered to all 5 of these factors, their GERD symptoms were reduced by 37%. So why does this matter for you? You may not have GERD or any sort of acid reflux or heartburn, but as I mentioned in our interview with Dr. Jonathan Aviv, GERD and acid reflux aren't just unpleasant, they can have a lasting negative impact on your health, including an increased risk of cancer. We've also seen more and more stories coming out about the scary side effects of GERD medications, like increased risk of death, and know that even without side effects, none of these medications treat the root cause. These 2 studies are reminders that our daily lifestyle choices can make or break our health. You definitely know someone with some symptoms of heartburn or acid reflux, or even you might know somebody with GERD. So make sure to show them this or have them listen to it because this could be life-saving. All right, now story number 6 is all about endometriosis and tanning beds, if you can believe it, or sunbathing. A new study suggests that women who use tanning beds or go sunbathing have an increased risk of developing endometriosis, a painful chronic condition in which uterine tissue grows outside of the uterus. In the study, researchers used data from over 116,000 female nurses aged 25 to 42 and compared the incidence of endometriosis to the women's tanning behavior. They found that those who used a tanning bed 3 or more times per year had a 30% higher risk of developing endometriosis than those who never used tanning beds, while getting 5 or more sunburns during adolescence, and I definitely had more than that, increased the risk by 10%. The data also suggested that regularly sunbathing during the summer was associated with a 10% increased risk. Interestingly, people who lived at high elevations or in sunnier places actually had a reduced risk of endometriosis, suggesting that getting regular moderate exposure to the sun can be beneficial, while the concentrated UVB exposure required for tanning can be harmful. So if you're not somebody who basks in the sun or worships the sun and goes tanning, you might be wondering why this matters for your health. Well, it can seem often like the advice about sun exposure and sun protection is contradictory. Getting too much sun exposure can cause cancer, but at the same time, many people are vitamin D deficient, and many sunscreens carry risks of their own. Finding the right balance can be tricky, but this study makes one thing clear. Intentionally getting excessive exposure to UVB rays in an attempt to get a tan has serious consequences. We recommend getting moderate sun exposure to ensure you get enough vitamin D and protecting your skin with clothing or mineral-based sunscreen if you're going to be out in strong sunlight for a prolonged period of time. And this probably goes without saying, don't go to tanning salons. All right, now story number 7 is about pollution and babies and fetal health. We've got 2 new studies on this topic. The first shows that microplastic particles were found in the placentas of unborn babies, and the second shows high levels of heavy metals were found in a number of widely popular baby food brands. So let's talk about the microplastics first. In a small but troubling study, researchers analyzed the placentas of 6 women and found microplastic particles in 4 of them. A dozen different plastic particles were found, but since the study only looked at 4% of each placenta, it's estimated that the actual number of microplastics was much higher. The plastics were detected on both the fetal and maternal side of the placenta, as well as in the membrane where the fetus develops, and were small enough that they could have likely passed it into the baby's bloodstream. It's likely that the microplastic particles came from items like packaging, cosmetics, or personal care products, and were consumed or breathed in by the mothers. 2 of the placentas had no microplastic particles, which could be the result of different physiology or different lifestyle and diet. Another troubling finding for infant health came out of a report by a congressional subcommittee that measured heavy metal content in popular baby food brands. They drew on data from 4 companies, Gerber, Happy Baby Organics, Beechnut, and Earth's Best Organic. Yes, even organic baby food companies have issues with this, and found levels of heavy metals like arsenic, lead, and cadmium at levels that are far higher than levels allowed in other products like bottled water. For example, the company that makes Happy Baby Organics found levels of inorganic arsenic that exceeded 100 parts per billion, the limit proposed by the FDA for infant cereal in 2016. Several baby food brands, including Parents' Choice Organics, Sprout Organic, and Plum Organics, refused to provide data, raising concerns that they had even higher levels of these toxic metals. Heavy metals do naturally occur in some grains and vegetables, but manufacturers aren't taking into account that these levels can increase when they interact with other ingredients that are added to the foods. This means that when they just measure the levels of individual ingredients and add them up, rather than looking at the final product and measuring that, they're often greatly underestimating the heavy metal content in these baby foods. All right, so why does this matter? You might not have a baby in your life, but you definitely know somebody who has had one or will have one at some point. And not to state the obvious, but microplastics and heavy metals aren't supposed to be inside of our bodies, and they can negatively affect our health when they get in there. These health risks become even more pronounced for babies who are much more vulnerable than adults. For unborn babies, microplastics can impair growth as well as immune system development. And babies who are exposed to high levels of heavy metals are at a heightened risk for behavioral impairments, as well as brain damage and death. Both of these new findings show the alarming ways in which our polluted world puts our most susceptible populations, fetuses and infants, at risk, and the lack of protection we have from federal regulations. Because there aren't policies in place to keep toxins out of our bodies, we need to be extra diligent about keeping these toxins out of our lives and bodies and the lives and the bodies of any little humans we're responsible for. All right, story number 8. This one is a little shorter and relates to high blood pressure medication and schizophrenia risk, something you may not be thinking about, but you definitely know somebody who takes high blood pressure meds, so listen up. High blood pressure is common among people with psychological disorders like schizophrenia, and a new study sheds some light on that relationship. Researchers analyzed data from over 40,000 patients with schizophrenia and over 64,000 controls, meaning people that did not have schizophrenia, and found that those who had significantly lower levels of the protein ACE had lower blood pressure, but also had an increased risk of schizophrenia. This is concerning because people with high blood pressure are often prescribed ACE inhibiting drugs to lower their blood pressure, but this could also have the unwanted effect of heightening their schizophrenia risk. The researchers noted that since hypertension medication is generally prescribed later in life, and schizophrenia generally sets in during adolescence or early adulthood, but not always necessarily, it's unlikely that the medications actually cause schizophrenia. However, they believe that taking medications that lower levels of ACE could worsen symptoms or trigger a new schizophrenic episode. I always advocate for treating the root cause of your symptoms rather than masking them with prescriptions that come with unwanted side effects. And this research reaffirms why that's so important. High blood pressure can be a very serious, life-threatening problem, but it can almost always be addressed through lifestyle interventions, like eating a healthy, whole foods, mostly plant-based diet, getting enough exercise, and reducing stress, which are all things that are great for your well-being anyway. All right, we've got 2 left. Story number 9 is a short story that examined the relationship between sleep and then dementia and mortality or death. So researchers looked at data from over 2,800 adults over the age of 65 to examine the relationship between sleep and both dementia and mortality. Their findings showed that getting fewer than 5 hours of sleep per night had a strong association with dementia, while difficulty maintaining alertness, napping, and poor sleep quality were associated with mortality. Alzheimer's and dementia are huge issues, with almost 6 million American adults currently afflicted, and the number expected to rise over the next few decades. What's more, sleep disturbances are very common among older age groups who are most at risk for developing dementia, which makes these findings worrisome. However, the good news is that sleep is something most of us have control over, so we can all protect our brain health by prioritizing our rest. That means getting 7 to 9 hours a night and practicing good sleep hygiene to ensure we're getting high-quality sleep. Last but not least, story number 10 is about our favorite topic, exercise. Yes, it's really important for your health, but we have something more specific to share with you today. In the weight loss world, it's usually the conventional wisdom that you have to focus on diet because you can't lose weight through exercise alone. Well, a new study says that you can, but only if you get a certain amount, and that amount might be kind of a lot to you. In the study, researchers had participants exercise so that they burned either 1,500 or 3,000 calories per week, then measured how many extra calories they consumed to offset the exercise. They found that regardless of how much people exercised, they ended up eating about an extra 1,000 calories each week, which meant that those burning 1,500 exercise calories weren't in enough of a deficit to lose those pounds, while those burning 3,000 were. Remember that a pound of body fat equals about 3,500 calories. So their takeaway was, if you want to lose weight through exercise alone without adjusting your diet, you need to work out enough to burn 3,000 extra calories a week, which they calculated to be equivalent to about 300 minutes per week, or 5 hours of exercise per week. So those are our top 10 stories from the January to March 2021 wrap-up. And you might be thinking, what about the vaccines that we keep hearing about in the news? Are you guys going to talk about that? Right now, there's been a lot of health news about the COVID-19 vaccines, but vaccines are a complex topic, and the research on the current batch of COVID vaccines is very, very new and changing every day. Therefore, I don't feel there's enough data at this time to really take a concrete stance, especially on a podcast episode that might be completely outdated in a few weeks. However, I will point you to some of the vaccine-related articles we've rounded up over the past few months that stood out to us on the written version of this episode. And you'll find a link to that in the show notes. You can check them out there. I'd also love to hear your thoughts on any or all of this news in the comments section on the bottom of the article version, the same one I just mentioned, of this episode. So definitely go there and check it out and leave me a comment so I can see it. Also, while you're there, don't forget to check out A Roadmap to Healing, the new program I mentioned from getwellbe and the Heal documentary team that will open in a few short weeks. And don't forget to become a getwellbe insider if you aren't already, so that you can get all of our latest content, special offers, and personal notes I don't share anywhere else weekly in your inbox. Plus, you'll get a free copy of my audio guide on how to feel the best you've ever felt and heal anything, the 10 things you need to optimize your health and heal any health issue, big or small, naturally. Even if you're the healthiest person out there, I promise you'll learn something you didn't know before. All right, I'll see you back here next week for another episode of the getwellbe podcast. If you haven't already and found this episode helpful or interesting, subscribe to the podcast. This way you'll never miss a new episode and they'll be delivered to you whenever we publish a new one. And please share this episode with family or friends who you think might find it valuable and informative. It means a lot and helps more people find the podcast. If you already have, then thank you so much. I really appreciate it. Once again, this is your host, Adrienne Nolan-Smith, and thanks for listening to the getwellbe podcast.